Introduction to this book. Scattered Minds is a deeply compassionate book that redefines ADHD not as a fixed brain disorder, but as a developmental response to early emotional stress. Gabor Maté, a physician who also has ADHD, argues that the condition is rooted in the subtle ways children adapt to stress, disconnection, or emotional absence during their earliest years, especially from parents who were themselves overwhelmed, distracted, or unsupported. Instead of blaming genetics or poor parenting, the book explains how ADHD traits like distractibility, impulsivity, and restlessness are survival mechanisms, ways the child copes with a world that doesn't feel emotionally safe or predictable. ADHD is seen as a delayed development in self-regulation and attention, not as a life sentence. To someone with ADHD, this book says, "You are not broken, lazy, or flawed. Your brain adapted to protect you, and healing is possible, even in adulthood. With self-awareness, compassion, and the right environment, you can reshape your mind, understand your emotions, and finally feel whole." Gabor Maté's Scattered Minds is a seminal work on attention deficit disorder (ADD), notable for challenging the conventional biomedical understanding of ADHD as a purely genetic disorder. Maté, both a physician and a person with ADD, uses personal experience, clinical insight, and developmental psychology to present a nuanced theory of the condition. That ADD is rooted in early childhood emotional development and shaped by a child's environment, particularly by the quality of parental attunement and attachment. At the heart of Maté's thesis is the idea that ADD is not an inherited pathology, but a developmental disorder born from a failure of emotional and neurological integration in infancy and early childhood. He emphasizes that while there may be genetic predispositions, these are not destinies. Rather, ADD arises from the interaction between these genetic sensitivities and an environment that fails to meet the child's emotional needs for connection, safety, and predictability. He explains that a baby's brain is still under construction after birth, heavily reliant on the emotional exchanges with caregivers for the proper development of self-regulation systems. When caregivers are emotionally unavailable, due to stress, trauma, depression, cultural pressures, or their own unresolved childhood wounds, the infant's brain development is subtly but powerfully affected. The circuits involved in attention, motivation, and emotional regulation do not fully develop, resulting in the fragmented attentional system that characterizes ADD. Maté argues that the symptoms commonly associated with ADD, distractibility, impulsiveness, hyperactivity, are not arbitrary or meaningless. They are psychological adaptations to overwhelming or inconsistent environments during early development. Tuning out, for example, is not merely a lapse in attention, but a survival mechanism used by the infant to escape emotional pain or chaos when attunement with the caregiver is broken. The book delves into Maté's own life with vulnerability and clarity. He recounts his early experiences as a Jewish infant born during World War II in Nazi-occupied Hungary, where separation, fear, and anxiety were imprinted into his being before language or logic could intervene. These origins, he suggests, seeded the neurological patterns of ADD in his own brain. Importantly, Maté's children were also diagnosed with ADD. Not, he insists, because of bad parenting, but because of unrecognized and unresolved emotional dynamics that reverberated through generations. He breaks down the developmental trajectory of ADD in both children and adults. For children, ADD manifests as distractibility, poor impulse control, difficulty following instructions, and often social rejection or misunderstanding. For adults, the condition can mutate into procrastination, workaholism, emotional volatility, and chronic disorganization. Adults often have deep feelings of shame, inadequacy, and a chronic sense of being out of sync with life. Despite often being intelligent, creative, and intuitive, many adults with ADD feel like underachievers, plagued by guilt and self-recrimination. Maté is careful to distinguish ADD from moral or personal failure. He emphasizes that blame is counterproductive. Instead, what is needed is compassionate inquiry into the underlying emotional history of each individual. Healing, in his view, requires reconnecting with the wounded inner child who had to develop these patterns to survive. Medications like Ritalin or Dexedrine can help by stimulating underactive parts of the brain, but Mate stresses they are not cures. They are tools that must be integrated into a broader framework of self-understanding and emotional healing. Central to his healing model is the idea that adults with ADD must reparent themselves. They must provide the emotional consistency, self-respect, and mindful attention that were missing in childhood. He encourages practices like mindfulness, body awareness, psychotherapy, creative self-expression, and connection with safe and nurturing relationships. In children, healing ADD means creating an emotionally safe home where the child feels seen, accepted, and guided, rather than managed, punished, or corrected. The book critiques how society handles ADD, especially in education and medicine. Our culture, Mate argues, is frenzied, overstimulating, and achievement-driven, conditions that themselves are antithetical to healthy emotional development. In such a culture, the sensitive child is especially vulnerable. Instead of adapting our systems to meet the emotional needs of these children, we pathologize their behavior and medicate their symptoms. Mate calls for a more compassionate, socially aware understanding of mental health, one that recognizes that symptoms are signals, not enemies. In the final chapters, Mate outlines how both children and adults can grow beyond the limitations of ADD. Healing is not about fixing something broken, but about nurturing what was stunted or underdeveloped. It's a lifelong journey of integration. While the past cannot be changed, the future can be rewritten with awareness, compassion, and support. Neurological change is possible at any age, thanks to the brain's plasticity, especially when we commit to being present, patient, and kind to ourselves. It's self-inquiry. Reflect on your early childhood experiences. Were your emotional needs consistently met? Were your caregivers emotionally available? Understanding your past is the first step to transforming its impact. 2. Track your triggers and patterns. Pay attention to when ADD symptoms become most pronounced. Are they tied to emotional stress, fatigue, conflict? This helps distinguish the emotional roots from external behaviors. 3. Practice mindfulness and presence. Cultivate the ability to observe your thoughts and emotions without judgment. This may include meditation, yoga, or body scans. These practices strengthen the brain's regulation systems. 4. Reparent yourself. Offer yourself the guidance, validation, and structure you may have missed in childhood. Create routines, set gentle boundaries, and speak to yourself as you would to a child you love. 5. Seek attuned relationships. Connect with people who see and accept you without trying to fix or judge. Emotional healing happens best in relationship. 6. Work with a therapist, especially one trained in developmental trauma or attachment-based therapy. You're not fixing a broken brain. You're nurturing an underdeveloped one. 7. Use medication judiciously. If stimulants are prescribed, use them as a bridge, not a replacement, for deeper healing work. Understand their benefits and limitations. 8. Simplify and slow down. Reduce external overstimulation where possible. Structure your environment to promote calm, clarity, and focus. 9. Parent differently. If you have children with ADD, shift from discipline to connection. Validate their emotional experience before correcting behavior. Don't punish what they cannot yet regulate. 10. Advocate for systemic change. Support educational and social policies that prioritize emotional development rather than standardize performance. Testing and quizzes to understand if you might have ADHD, inspired by the book. While Mate does not propose a specific test, he encourages a holistic, reflective approach to diagnosis rather than rigid clinical criteria. That said, you can begin with self-reflective questions based on Mate's clinical insights. O. Do you frequently feel overwhelmed by tasks others manage with ease? O. Is procrastination a major part of your life? despite knowing better? Oh, do you often feel tuned out, emotionally or mentally? Oh, do you struggle with sustaining attention, even during things you care about? Oh, are you frequently late, disorganized, or forgetful? Oh, do you often feel like you're one crouton short of a Caesar salad, as one patient put it? Oh, do you live in extremes, overcommitting then collapsing? Oh, do you feel like you never quite reached your potential, even though others say you're talented? Books and tools for further assessment. Oh, Driven to Distraction by Edward Hollowell and John Rady include self-tests. Oh, the Adult ADHD Self-Report Scale ASRS V1.1 from the World Health Organization. Oh, Gabor Maté's own resources and talks often include workshops or guided inquiry processes. Maté's approach is not about diagnosing and labeling. It's about understanding the deep developmental story behind attention and presence. His work invites us not just to treat symptoms, but to engage with the mystery of our own becoming, with empathy, curiosity, and hope.